imagine that many of you sitting here have children. And if you do, surely have experienced them getting sick. For some reason, it always happens at night or as soon as the GP or pediatrician is closed down. At first, your child might be getting a little bit warm, a little bit fussy, perhaps crying a little bit. And maybe your child is too young to explain to you what's wrong. Maybe the crying intensifies a little bit now, and the breathing is getting a little bit faster, and perhaps your breathing is getting a little bit faster as well. What do you do in these situations? Do you have a lifeline? Perhaps you call your mother or a friend, or perhaps you try going to the hospital at night or in the evening. So you sit there with your child, waiting maybe for hours and hours, and finally the doctor arrives just to tell you that in his or her opinion, your child has mild symptoms, doesn't need any treatment, doesn't need any test. You can go home and come back if it gets worse. So we can all agree that children are the most valuable thing, and parents are extremely afraid to overlook important symptoms when their children get sick. However, 1 out of 3 children that we see in the pediatric departments in the capital area of Denmark can be sent home without any treatment. That's 27,000 children each year. And this isn't just a Danish phenomenon, this is seen in pediatric departments all over. So, is this a problem? Yeah, because unfortunately we don't have unlimited doctors and nurses for these parents who sit and wait for hours and hours. So we thought, could it be possible to somehow empower these parents in handling sick children with mild symptoms at home? There is a lot of information out there for parents to read when their children get sick. But there are a few issues with a lot of the information, especially online. It's often written in a difficult language, and it's often based on diseases, not on the symptoms that you see in your child. So you might see a coughing in your child, and then suddenly you're reading on asthma or pneumonia, and now you're getting pretty sure that your child needs to be seen by the doctor or needs some treatment. So instead we decided to develop video guidelines that gave us the opportunity to explain the symptoms or illustrate them in a more visual way. And we made 8 videos on the most common symptoms in sick children, explaining the symptoms, what can be done at home, and when to seek medical advice. So I would like to show you a short clip of one of our videos.
Tips from paediatricians. Fever. A fever is a temperature of 38 degrees Celsius or more. It's not an illness in itself, but a natural sign that the body's reacting as it should be when you're ill. In by far the majority of cases, the fever is a viral infection like a cold or a flu, or an airway or stomach infection. They'll go away by itself without antibiotics like penicillin.
So for us, the next step was to test our videos on our target group, parents with sick children. So we offered all parents who called the Copenhagen Emergency Medical Services in Copenhagen, that's a medical helpline in the capital area of Denmark. We offered the parents to receive our videos. If they wanted to, they either got a regular phone visitation by a doctor or nurse, or they received our videos followed by call disconnection. Of course, they were told about that and they could call back if they still wanted to talk to a doctor or nurse. We also asked them to fill out a questionnaire on empowerment the following day, and we also tracked if the child was admitted to hospital within the next 3 days. Because we wanted to make sure that the videos didn't make the parents feel overconfident, resulting in a delayed treatment of any of these children. So what we found was that the group who received videos actually did report back an increased score of empowerment. We also found that had the parents watched 1 video or more, there were fewer admissions to hospital. And and we had no incidents of delayed treatment. So now our videos are available to all parents in Denmark in Danish, English and Arabic. But what can we learn from this project? So we believe that simple visual guidelines like ours could be used in many fields, as these issues I told you about with pediatric health information applies just as well to adult health information. And we believe that these visual guidelines could increase empowerment and health literacy overall, and be the benefit of many patients. Thank you so much for your time and attention, and thank you to my dear colleagues who also